Pain in the knees, severe pain when someone tries to climb up the stairs, unable to get up from sitting position from the floor. Well, these are some of the symptoms which all of you must have heard. At least one person in the family, one person in the house complain of at some point or the other. Hey guys, Dr. Na'eem Sadiq, neurologist, stem cell therapist, founder of Plexus, Neuro and Stem Cell Research Center. Coming to you yet again with another interesting topic. Well, today's topic is arthritis. Well, you must be wondering, Dr. Na'eem, neurologist, why is he talking about arthritis? Well, there are reasons for that. Number one, because of the amazing response which I and all my colleagues practicing stem cell therapy or regenerative medicine are getting all over the world. And two, because May is the month of arthritis awareness. So I thought it was appropriate at this point of time to talk to you about arthritis, the symptoms of arthritis, how do we diagnose that, what are the different modes of treatment, and what does stem cell have to offer in the treatment of arthritis. And yes, of course, like I always do, how do we prevent it? Coming to the numbers, in US, the incidence is around 54 million number of people who are suffering from arthritis. Although in India, we don't have a registry where all the cases are recorded, but a rough estimate would be around, what has been reported is around 15 million. But the number of cases which I come across and my colleagues all over India come across is huge, huge, huge. Almost every other person above the age of 45, 50 years at some point or the other starts complaining of pain in the knee joints. Well, at this point of time, I would like to bring to you some very interesting numbers, some interesting facts which are alarming. How much pressure can the knee joint take? Now, if you understand the knee joint, it is the joint wherein the entire weight of the body rests. And then we walk around, we move, we run, we jump, we jog, we climb, we do all kinds of things using the same knee joints. So 1 kg of body weight transmits around 3 times, that is 3 kgs of pressure on the knee joint. Now, if you take an average person weighs around 70 kgs, if you multiply 70 by 3, it becomes 210. And an average person roughly walks around 5,000 steps a day. Times 5,000, it comes to 10,50,000 kgs of pressure. And if you multiply that by 365 days, in a year, the pressure which the knee takes is a huge figure of 38 crores, 32 lakhs and 50,000. Now this we are talking about when the person is just walking. Now consider the variables here would be the stride, how fast is the person walking, the weight of the person, the kind of footwear the person is wearing, the gradient on which the person is walking. Is it a smooth surface? Is it an uphill? There are so many factors here. So just imagine how much of pressure, how much of stress we are giving our knees every day, every single day of our life. Let me show you the diagram of the knee as to what is the knee made up of. The knee, the joint which takes so much of pressure, what are the components of that? Now, if you look at this diagram here, this is this area which is colored in red and blue comprises the knee joint. The upper part is the thigh and the lower part is the leg. Now, upper part has one bone, the thigh region, and the lower part, which is the leg, has 2 bones. The area which is marked blue here is the cartilage. It is known as the articular cartilage. Let me try to give you an example of a mechanical device. Now, if there are two metallic components which are sitting on each other and which have to move in one direction or two directions, whatever, then number one, there should be some space between the upper and the lower end. So the space between the upper and the lower end, which is known as the joint space or the articular space. And when this sits on each other, if you have just the metallic thing, then the rubbing will be too much, there's too much friction and the movement will be restricted. So here this articular cartilage works as a rubber or like a heel in our shoe, something which softens it. Now where these two part of this bone sits, we hear that these blue here we have something which we call as the meniscus. We have two of these, one on the lateral side and one on the medial side. Now this works as a cushion where these two condyles, we call them, when they sit, the impact is reduced. Now in the joint space, we have a fluid which is known as a synovial fluid, which is enclosed in a synovial membrane. This fluid, along with the menisci and the joint space, all three help in taking this impact, this stress, which is a huge amount of stress which falls on the knee. Plus, there are several ligaments which support or bind the knee. Like for example, when we have two things kept, we put either bands on each side or tie it with ropes or whatever. We have the ACL, which is known as the anterior cruciate ligament, and then we have the collateral ligaments on each side. Now, all these things put together comprise the knee joint. It is one small knee joint which takes the entire body weight, and we abuse it day in and day out. So what happens when arthritis sets in? This was a normal knee joint, and this is a joint which has been affected by arthritis. Now this articular cartilage here is destroyed. It is eroded. Similar to the heel of a shoe. When you buy the shoe, the heel is, maybe about a centimeter or so. 3 months, 4 months, 5 months, 6 months later, depending on the use, the heel starts becoming thinner and thinner. Or take an example of a tire. So the same thing happens here. The articular cartilage gets eroded, becomes thin. Then the joint space which I was talking to you about gets reduced. The space, instead of being this much, has come closer. The two bones have come closer to each other. Along with this, there is damage to both the menisci and the ligaments, the collateral ligaments or the cruciate ligament. They start thinning out, start getting degenerated, and may start tearing. The tear might be a partial tear or it might be a complete tear, like it has been shown here. So the degeneration of the menisci, the reduction in the articular surface of the joint space, the erosion of the cartilage, and damage to the ligaments, all these put together makes up an arthritic knee. What are the symptoms of arthritis, which I was talking to you about? All of you must be very, very well aware of this. One most important thing is pain. 2, restriction of movement, unable to climb stairs, unable to get up from sitting position from the floor, unable to board a car. These are the common symptoms in the initial stage, and as the disease advances, then the patient develops a typical gait which is known as a waddling gait. Plus, there might be deformity of the knees as well. What are the predisposing factors? 1, age. As age advances, the degeneration sets in, but then things can happen. Even we have had so many cases, patients in their 30s or 40s coming to us with pictures like this. Bad lifestyle, obesity, lack of physical activity, lack of exercise. These are some of the predisposing factors which lead to an early osteoarthritis or early arthritis. Now, once the arthritis sets in, what do we do? What is the treatment? What are the treatment modalities? Number one, as usual, the conservative management. Conservative management using painkillers, the normal NSAIDs. Along with that, you might be subjected to physical therapy, some exercises, and modification of lifestyle. Now, as the disease advances, the painkillers and exercises and physical therapy, none of these help you. What are the other methods? Something which had become popular, which is still popular, is a surgical technique wherein there is a total knee replacement. Now, for people who do not want to opt for a surgical technique, we are here with stem cell therapy. Now, stem cell therapy has given amazing response, very, very good results in almost all the patients whom we have treated for osteoarthritis and whom people all over the world have treated for osteoarthritis. The technique of stem cell therapy is very simple, which I've been talking to you in my earlier presentations. We take a sample of bone marrow. It is a non-surgical technique. Under local anesthesia, the patient does not put under general anesthesia. It takes about 2 to 3 minutes. A sample of bone marrow is taken. Once the bone marrow is taken, from this we take out the mesenchymal stem cells, which we call as MSCs, and then convert them into cartilage cells, and these cartilage cells are injected. All this happens as a daycare procedure. The patient is not admitted at any point of time. And after the injection, the patient need not be under rest. Patient can resume his normal activity, can continue his work the next day itself. There is no rest needed. After the stem cell injections, the response starts as early as second week. The pain starts reducing from second to third week onwards itself, depending on the stage of the osteoarthritis and depending on the weight of the patient and the activity of the patient. And subsequently, if the patient does a repeat examination of an MRI or an X-ray, we see most of the damage which had happened here has got repaired. Not only does the cartilage, the joint space, but also the meniscus and the ligaments, all these start healing. And like we always say, the best response is when the patient stops complaining of pain and stops taking the painkiller medicines. That's the advantage of stem cell therapy. While we are discussing arthritis and the knee joint, let me steal a few moments and take you to something very interesting and which is very common. Sports injuries. There are hundreds of patients who have come to our center and who are visiting various other people who are using stem cell technology. We have had an amazing response. And one live example is standing before you. I had sustained a meniscal tear and an ACL tear. I underwent stem cell therapy and it took me about 2.5 to 3 months to get back to the ring. And ever since, I've been boxing, I've been running, I've been doing my gym activity as usual. In fact, we have posted the videos on our Facebook and Instagram. Well, coming back to the sports injuries, people who are athletes, like I was talking about myself, either boxing, running, tennis, soccer, football, any of these, the ACL tear or the meniscal tear is extremely common. Without surgery, without intervening, without cutting open, just a simple shot of stem cells, and these things can be repaired. They can come back to normal as they were earlier, which can be documented on an MRI, which can be documented by a person's lifestyle when he goes back to his normal sport which he was doing. And of course, no pain and no painkillers. Well, now, as usual, I take you to towards the preventive side of arthritis. Well, can arthritis be prevented? That's a difficult question. Can age be stopped? Okay, I'm sure we cannot stop our age, we cannot stop our degeneration. But yes, we can delay the degeneration, we can delay the arthritis, or maybe minimize the arthritis. How? One most important thing is a healthy lifestyle. Now, what does this healthy lifestyle comprise of? Good, healthy diet, fitness, maintain your weight. Simple. Healthy lifestyle can prevent this or delay this or minimize this. Since today, May 20th, is the day for awareness of arthritis and autoimmune disorders, let me spend some time explaining to you guys as to what is autoimmune disorders and what is the role of stem cell therapy in autoimmune disorders. Now, before we proceed to autoimmune disorders, what do we understand by the term autoimmune disorders? In our body, we have a normal defense mechanism, which is known as our normal immunity. You must have heard, people say, okay, his immunity is low, he keeps falling sick, etc. Well, when there is an invasion, there is an attack by anything foreign, be it a bacteria or a virus or even something which you're allergic to, then the normal response in our body, the immune system, fights against this. This is the normal immunity. Like, for instance, the soldiers who are standing at the border, they are supposed to defend the country. Now, when there is any invasion from any neighbor, then they try to attack those invaders or people who are intruding. That's normal defense mechanism or normal immunity. At times, in certain people, this happens within. For example, now the soldiers who, instead of fighting against the enemy or against the invaders, they start fighting among themselves. That's exactly what happens in auto. Auto means self. In autoimmune disorders, antibodies are produced which attack body's own organs. My cells are attacking my own organs. That's known as autoimmune disorder. Now, these antibodies go and lodge themselves in different parts of the body. Depending on which organ they latch on, that particular organ suffers and the ensuing damage and the ensuing disease occurs. Now, for instance, if the antibodies affect the brain, then we have brain and the nervous system. We have diseases such as multiple sclerosis, Guillain-Barré syndrome, or myasthenia gravis, or a demyelinating polyneuropathy. If it affects the blood, wherein all the tissues are affected, for instance, the kidneys, the blood vessels, then it results in lupus. If the antibodies go and damage the skin, we have the conditions which are very common, which is psoriasis and eczema. Muscles, results in muscular dystrophy. If it affects the bones and joints, we have a very, very common disorder, which is rheumatoid arthritis and ankylosing spondylitis. In thyroid, we have Graves' disease, and if it affects the gastrointestinal system, it results in Crohn's disease. And if pancreas are affected, we get type 1 diabetes mellitus. So the mechanism is the same. The immune system has gone mad, has gone crazy. It's attacking its own organs. Which organ is affected? That disease happens. Now, in the last so many years, the number of patients who have come to us and who are seeking treatment in several other centers all over the world for stem cell therapy, the commonest ones and the ones which have given us very good results are, number one is rheumatoid arthritis. Then we have had several cases of psoriasis. Of course, MS and GBS is my own field. I keep treating so many patients of multiple sclerosis and either Guillain-Barré or a demyelinating polyneuropathy. Type 1 diabetes mellitus. These are conditions which have given excellent results all over. Now, coming to rheumatoid arthritis, I'll spend a few moments on that. since it is one of those conditions which has affected several people and where there is no definite treatment. Patients go on NSAIDs, the painkillers, or they go on to corticosteroids or the anti-cancer drugs, which is full of side effects. There are a lot of people who prefer the disease more than the side effects. Or there's nothing else available, so go to alternative medicines. Try acupuncture, acupressure, homeopathy, Ayurveda, whatever gives them relief. I will not go into the details of the symptoms and the findings and presentations. Well, it is an arthritis where you have joint stiffness, where there's the disfigurement of the joints, early morning stiffness, etc. But what is more important is the severe pain, which the patients cannot tolerate. In psoriasis, you have silver scaly lesions, which may start in one part of the body and affect different regions. In fact, one of the worst cases which I have had is where neck below, this was a very young patient, neck below, the entire body was affected, excluding just the fingers and the toes. Now, these are conditions where stem cells have given extremely good results. Now, if you have been following my presentations, I've been talking about the mechanism of stem cells. One of the well-known and well-established mechanism of stem cell therapy is it modulates the immune system. Well, now here we have an autoimmune disorder where the immune system has gone haywire and attacking its own cells. Now, with the introduction of the MSCs, or the mesenchymal stem cells, these cells calm down. And the crazy reaction which the cells were producing, the antibodies which they were producing, they all start reducing. In fact, we have had several cases of lupus, we have had cases of Graves' disease, and lots of cases of type 1 diabetes mellitus as well, who have had extremely good results with stem cell therapy. The course of the therapy is very simple and the cost is also very, very affordable. And of course, there is no admission and no known side effects either at our center or anywhere in the world. Well, guys, that was a brief presentation on arthritis and autoimmune disorders, since today was a day for Arthritis and Autoimmune Awareness Day, and this month is the month for Arthritis Awareness Month. I hope I have tried to convey the message to you. If there are any questions, if there are any comments, please feel free to post them, ask me, I'll be glad to answer them. And I'll be back very soon with another very interesting and informative presentation to you guys. Till then, be safe, be fit, delay your degeneration. Bye-bye.